Hi everybody, Dr. Ellie Stein here with a video on how to improve your balance through, you guessed it, neuroplasticity. Now I have my eyes closed for a reason, which I will explain in due course, but I'm going to open my eyes for now so I can feel like I'm talking to you directly. In my medical practice, I came to learn that people with complex chronic diseases have poor balance and are more likely to fall. The reason for this is due to neuroplasticity. If you don't use it, you lose it. And if we don't do things that require us to challenge our balance, those neural pathways in the brain unwire, right, get broken down and recycled, and we lose the capacity. This was really brought home to me when I had my foot injury. I went to physiotherapy, and the first thing the physio did was ask me to stand on 1 foot. 1 foot. What I noticed was on my injured foot, my balance was extremely poor. I had been doing things differently, I guess, unbeknownst to me. It had affected my brain ability to pattern balance, and I had lost a lot of skill. One of the first things she asked me to do was to go down to the beach every day. That was quite a hardship. Take my shoes and socks off and stand on 1 foot in the sand, which is uneven ground. As soon as I do that, and you can try it now if you want, as soon as you stand on 1 foot, you're going to notice lots of little adjustments. Your foot wobbles in different directions, and that gives signals to the little muscles in your foot that they have to adjust and figure out how to compensate for the wobbles so that you stay upright. It's made me think about what are the steps I'm taking to improve my balance again, and would they be helpful for others? So I'm going to run them by you. I think the first step is to be on even ground with your shoes on for extra support, with your eyes open, and stand on 1 foot. Now, most of us can do that, but you will feel your foot wobbling and all the little muscles firing, and that's exactly what you want. That is going to fire. The more you fire together, the more you wire together. And through neuroplasticity, that's going to rewire your brain. You're going to become better at balance. The next levels of this, and the exact order might differ for different people. One is to do it with your shoes off, so relying more on your foot to provide the balance rather than the shoe. Another challenge is to do it on uneven ground. So again, that's going to require a little bit different skill. Another challenge, and I would start this with your shoes on inside because it's really hard, is to stand on 1 foot and move your head. Now what this does is it separates the input coming from your eyes and the proprioceptive input coming from your feet. And it turns out that humans, we walk around with our eyes open, and the brain mostly looks to this visual input for a signal of whether we're in balance or not. So if you move your head, like I just did, it's challenging, but it's really important because it's teaching your brain to also pay attention to the signals coming from your feet. The most advanced level, in my opinion, is to do any of those things I've already mentioned with your eyes closed. Again, this takes away the visual input and really trains that proprioception, that ability to know every little part of our body, where it is in space and what it needs to do to keep our balance. Another great exercise is to walk as if you're on a tightrope. So kind of, we call that heel to toe walking. When your gait is wider and your feet are apart from each other, it's easier to balance. But when you have your feet close together and you're doing heel to toe walking, that's like a more advanced skill. Again, it's going to train your brain really well. And the final step is to do that. Yeah, you feel like you're a ballerina doing that, but to do that with your eyes closed. So those are some steps that I'm doing, and I am noticing improvement over the last couple months that I've been practicing these most days. And if you're someone who has been less active due to your illness, I would recommend doing some balance exercises at least a few times a week to decrease your chance of fall. Fall is never good. There's a lengthy recovery period during which time, you get more deconditioned. And of course, if you break a large bone, that's a risk factor in itself. So let me know what you think. Maybe you already practice balance. Maybe you have some exercises that you found especially helpful. Really interested to hear more.